As the leaves begin to change colors around us, it's impossible to not feel excitement for the activities fall brings, from apple picking to hay rides, cozy bonfires, and more. However, flu season is lurking around the corner, and it's important for us to consider health and safety while we enjoy the warmth of the fall season. My name is Nancy Quiroz Gomez, and I'm a nurse educator at St. Peter's University Hospital in New Brunswick, New Jersey. In this episode, I'll be speaking with Dr. Meg Fisher, a world-renowned pediatric infectious disease specialist, a special advisor to the New Jersey Department of Health Commissioner, and a board member for the American Academy of Pediatrics. During the COVID-19 pandemic, she served as the acting deputy commissioner for public health services. Dr. Fisher has received awards for teaching, community service, and service to the American Academy of Pediatrics. Together, we'll delve into the impact of the pandemic across the state and how we can move forward as children are back in school, along with some tips for this upcoming flu season. Dr. Fisher, welcome to St. Peter's Better for Life podcast. How are you today?
I am great, and I am delighted to be here and be with you today.
I'm happy you're here. Can you please just tell the audience a little bit about yourself?
Sure. So I'm a pediatric infectious disease subspecialist, which means that through my career, I've taken care of children with all kinds of infectious diseases. And then as I came to New Jersey, actually, to be the chair of pediatrics at Monmouth Medical Center. And then as the pandemic really came on, I said, boy, what a way to finish up my career to try to join the New Jersey Department of Health. And I was able to do that in 2020. And I also still stay at Monmouth Medical Center. I have a position there. And it's really been a delight to see a different aspect of infectious diseases, to see the public health aspects.
That's wonderful to hear. I mean, these accolades are just the icing on the cake. I mean, you've had so many years of experience. Can you tell me about your experience from the beginning of the pandemic, I guess late 2019 into early 2020?
Sure.
What was that like for you? What can you tell us?
Sure. So in late 2019, I think we really had no idea what was going to happen. You know, in December, we began to hear, oh, there's a virus happening in China, in Wuhan, China. And for me, it was actually a very interesting beginning of this pandemic, because I actually had I had tickets to go on a Viking cruise, which started in Wuhan.
Oh, wow.
And that was in April of 2020. Well, needless to say, that was canceled. Everything else was canceled. So it was really amazing to see what, maybe was going to be a little problem in a country across the world to a pandemic, the likes of which we have never seen before. When we started, as you know, New Jersey and New York were really the epicenter at the beginning of the pandemic. Yeah, the first cases were in Washington State, but the actual disease really came to New York City and New Jersey. It was March 4th in 2020 when we had our first hospitalized case, and from there, the numbers just went up exponentially. At the time, I was still the chair of pediatrics at Monmouth Medical Center and the Unterberg Children's Hospital, and very quickly, it became clear that this was a disease that was really taking over the adult population, and particularly the older folks. So, and there was not, fortunately, it wasn't children who were being affected early on. So we actually closed our pediatric ward so that we could take care of, we actually became an intensive care center
Wow.
for adult patients. And, one of my pediatricians was actually taken care of there, as well as our pediatric residents helped manage patients on the floor. So it was a very difficult time to not know what was going on. And I think particularly in the beginning of the pandemic, one of the hardest things was the changing information. So the changing ideas as we learned more, the recommendations changed, literally changed from week to week.
From week to week.
And that made people very uncomfortable. And unfortunately, over the course of the next couple years, it became a very political thing, and people just kind of lost their trust in science and in medicine. And I think that has been probably one of the most unfortunate things of this pandemic. Of course, not to say that that the 100,000 lives lost or the million lives lost is not, clearly more important, but it really has changed our whole society, I think.
No, of course. I mean, as a whole, it was just hard to navigate, right? And then dealing with your personal emotions and your personal experience through the pandemic, and then taking care of patients as a provider and family members, like all of that. I can't even begin to imagine on your end what it was like as a provider, right? But as a nurse in the emergency room, the amount of cases that I saw, the amount of people that I helped, and not being able to provide answers to all their questions, because every person that walked into our ER was positive.
Yeah.
And there were many that didn't know what COVID was, and they hadn't heard it in the news. We dealt with a lot of underserved communities, and most of the population was homeless that was coming into the ER. So they had no clue what was going on. And then when you see all of this happening in front of you, you just kind of try to reel yourself in. Did you find that at any point you needed to do that for yourself as well? Because as a provider, you have to have that stance and sometimes become stoic, and maybe to patients you might seem like you're emotionless, right? But how did you feel?
So I think it was difficult. The other thing that was difficult is we were all wearing masks. So sometimes you didn't have that ability to see someone's facial expression and sort of know how you were relating to them or how they were relating to you. And I think that was difficult.
Were you one of the hospitals that had the picture IDs? Because I think most places started doing that. I didn't get to do that.
Yeah.
I didn't get to do that. But I thought that was a nice idea. I've learned about it a little late, but people were carrying their pictures on the outside of whatever they were wearing, so the patients could see at least what they look like.
Absolutely. The other thing I think, one of the things that the American Academy of Pediatrics said very early on was, let's not talk about social distancing. Mm-hmm. Let's talk about physical distancing, because the exact thing we don't want to do is socially distance people. And unfortunately, that terminology was used a lot during 2020, and even sometimes now it's used.
Yeah, I was going to say, I've still heard it a lot.
And we really want to get away from that, because we know that the isolation, the having to be locked in at home, all of that really people had difficulty with it. It was very bad for people's mental health. And we know that isolation really, really inhibits your ability to interact well with others and to really lead your life like you want to lead your life.
Well, you actually just brought up a good topic. So with the pediatric population that you've encountered, looking at them now, do you find that maybe they may have some, social, I guess I want to say awkwardness, but do you find that they're lacking in social skills?
So I think this pandemic has affected all of us, and all of us are at different times in our development and our way of being. So it's clearly affected us differently. For young children who were at home and maybe they didn't even have siblings, I think it was very awkward and very difficult. And I think teachers are telling us now that some of those social skills they really don't have. Some of the modulating your own behavior, because you didn't have to get along with other people, that's been difficult. And I think our teachers, who I have the greatest respect for, they really are starting to help us get children back into understanding more about the social interactions. I mean, when we think about school, everybody knows school is the place where you go to learn things.
Right.
Well, it's not just book learning. You learn how to deal with others, how to get along with others, how to, we often say, like, recess should be just let the kids go out and play. Don't make it organized, because they need to figure out how to interact with each other, how to solve their problems with, in positive ways, how to work together, how to become teams. And I think we didn't have that for at least the first year of the pandemic, and we had it limited for the second year. I think so. That's the youngest. And then if you look at the children who are going through high school during the pandemic, they were suddenly taken out of school, away from all their contacts, told to learn at home on a computer, which some people were comfortable with, other people weren't comfortable with. Not everybody had computers. Even if the school gave you a computer, if you didn't have internet, that wasn't too helpful. So we have a whole group of adolescents going through the most difficult time of their lives for many people, this transition from adolescence into adulthood, and doing it in an environment where you didn't have your peer-to-peer connections.
But imagine, I can't even imagine, it wasn't even an option. It was just, we were all thrown into that, right?
Correct.
So work from home,
Yeah.
homeschooling. As an adult, I could barely sit in my seat for more than 10, 15 minutes before I want to get up and move around and just, shake in my chair. So I can't imagine
Yes.
a child, right, between the ages of like 4 and 9, let's say, that you can't get them to focus that long looking at a screen, right? So that for me was interesting because I have one niece and 3 nephews, and they were all, at that time, they were under the age of, let's say, 13 or 10, actually. So to get them to sit down to focus on one thing was hard. And
Sure.
parents with multiple children in the same home, that I feel that was a big issue. And now we're coming out of it. Maybe I could say the light at the end of the tunnel, right? What would be your suggestion for a parent that comes to you for advice? We went through this during the pandemic. My child may have some social skills that probably haven't fully developed. What would you tell a parent to do? How can they work on that?
So for me, you develop social skills by being social. So get involved with groups, whether it's in school, whether it's in preschool, early childhood development, or maybe it's your church, or maybe it's your synagogue, or maybe it's some community group, big brothers, big sisters. But get involved with, allow your children to get involved with other children. And again, don't make it so structured that you're telling them how to do it. Let them figure it out, because children are incredible. I mean, they're amazing at figuring things
Resilient.
out. And they are way more resilient than most of us. So, and we know now that adverse childhood events are horrible for children and affect their long-term health. We also know that over 400,000 children lost a caregiver during this pandemic, either a parent or grandparent or both. Those children will have that to live with their entire life. What can we do to help their resilience? Well, we know that a caring adult who's in that child's environment, it doesn't have to be in their home. It can be their nurse. It can be their pediatrician. It can be their teacher. It can be their coach. But a caring adult can make all the difference in the world, can really help that child who is struggling and really, really help them work through those struggles. And of course, our parents are very important. I think some days you love your parents, some days you didn't like your parents so much, but that what they are able to give you, and multi-generations, if you were lucky enough to have your grandparents, involved in your childhood, all of that's good. These are all caring adults who can help you really figure out the social skills. And there are people who say, oh, you can't be spoiling those children. Well, I'm a believer that you can't give a child enough love, and love doesn't spoil anyone. And as much love as we can give them and show them and model the behavior that we want them to take, so much the better.
And can I just say, when you just said about love, I think that there is such great truth to that. My grandmother is 94 years old. She just turned 95, had 10 children. Until this day, the amount of love that she gives to every single one of us is unparalleled. And I just want to bring up, besides bringing up my grandmother, there was a reason to that. She's just, so you said that you want to have someone that's your person, right? She's always been my person, which I'm grateful, and I'm very lucky that I have my mom and my grandmother. With that being said, those were the pillars of my childhood. Growing up, that's who I looked up to. Yes. So I know the importance that you're referring to of having that person, that structure in your home. I mean, I was raised by strong women, right? So strong women raise strong women. We just hope that we could do the same for our children.
Absolutely.
But it also did something for my mental health. And I had that during this pandemic. I was a travel nurse, so I was not home, but I could still reach out to them for love and support, even though I was not physically in the same area as they were. So with that being said, my question to you is for children with all these major changes going on through the pandemic, did you find anything in particular that maybe could have helped them besides having access to telehealth and their providers did you think that maybe there's a different way that we could have helped the children through their mental health struggles during the pandemic?
Well, we know that we had trouble with mental health even before the pandemic. So we have never been very good at destigmatizing mental health and behavioral health issues. And I think the first thing we have to do is understand that mental health is part of our general health. Unless your mind's in a good place, your body's not going to be in a good place. So really they work together, and we really need to approach a person as an entire person and think about their mental health as well as their physical health. We need to do this as healthcare providers, but we also need to do this as teachers, as community workers, as parents, as crossing guards. I mean, everyone who deals with children needs to be thinking, how can I help you? How can I be a model for you? In healthcare now, we're thinking a lot about trying to get away from that what's wrong with you into what happened to you and how can we make it better. So that compassion, we need to put compassion back into medicine. It's always been there, and I'll tell you at St. Peter's, I know it's here because I know your pediatric department, and I know Bipin Patel was the most compassionate man in the world. And that compassion is what will get us through and get us back to a better place. Because empathy alone is not enough. Empathy is, yeah, I feel your pain. Compassion is, I'd like to do something about your pain. So I think we can do that. People talk a lot about burnout, and they say, I don't have time for compassion. But we've shown in multiple studies that actually, if you're compassionate, if you take that time, it actually does not prolong your encounter. It makes a better encounter, and in fact, it makes you feel better. So one of the biggest ways to avoid burnout is to become more compassionate. I mean, we can say, I'm burned out, I got to take a vacation. And that's fine. People do need to take vacations. They do need to get away. But if you turn it around to what can you do at the point of care when you're interacting with people, that little bit of compassion, that little bit of listening carefully and not interrupting, but listening to your patients can make all the difference in the world, not only for them, but for you. So works both ways.
I agree, because I find that even through my career as an ER nurse, having those 10, I would say maybe 10, 15 minutes of just a conversation, and as like my boss would like to say, a meaningful conversation with my patients, I found that I learned as much of them as they learned from me. And it just opened up the space for deeper conversations that they may not have been able to have about their health in any other setting. But even those meaningful conversations have opened up an avenue for us now as our COVID-19 grant department goes out into the community to vaccinate and teach the population. I feel that we show compassion in different ways, right? But it is allowing us to have these conversations about the importance of vaccinations and helping us debunk the myths against the COVID-19 vaccine. So if we could kind of discuss that, you could kind of guide me into letting the public know you're working with the New Jersey Department of Health, your experience right now in this position, and how COVID-19 has been working here in New Jersey.
Sure. So, when we first got the vaccine in December of 2020, we didn't know how we would get it out to the population. And the Commissioner of Health then, Judith Persichelli, said, my goal is to vaccinate 70% of people. And, a lot of people just said, oh, that's ridiculous. It'll never happen. Well, not only did it happen, but we actually did it on time within 6 months, and we exceeded those goals. And we know that between getting people vaccinated and between people getting sick, some of them that weren't able to get vaccinated in time got the disease. Some of them got the disease despite being vaccinated, because we know the vaccination doesn't totally prevent infection. It just modifies the illness. So between vaccine and disease, we know that most of New Jersey now is pretty well protected. So we're not where we were in 2020, where we no one had any protection, and we didn't have any treatment. Not only do we now have protection because of past infections and because of for those of us like me, I'm protected by vaccinations. I'm one of those few who never got COVID-19. So I feel very good about that. And if or when I do get infected, I know now there's medications that I can take that will make it much more likely that I will survive the disease and do well.
So now that we're coming into flu and RSV season, you and I had a conversation not so long ago about there's a new RSV vaccine. Can you tell, you were mentioning that it is important to get vaccinated for flu and for RSV. And you see right now, I believe there's a rise in COVID yet again.
Yes.
What are your thoughts about these vaccinations? Can you kind of tell me, or just help me, how can I convince the public? Vaccines are important. It will keep you safe. There's a fear that the COVID-19 vaccine, it's going to exacerbate any existing medical condition. There's a fear that the RSV and the COVID-19 vaccine is going to affect a pregnant mother. All these things. And I'm here to try to educate the public, but I feel like it will be better received if it's coming from a credible source like yourself.
Sure. So I think what we know is that the diseases will negatively impact your health. So we know COVID-19 will make you sick, and we know that a certain percentage, maybe as high as 10%, of people who get COVID-19 will have long COVID or post-COVID or those lingering symptoms that are still present a month, 2 months, 6 months, for some people a year or two after you recover from your acute infection. So we know what happens with the diseases. We know that influenza, anyone who's had influenza knows that they don't want to get it again. It just knocks you for a loop. And we know that respiratory syncytial virus, RSV, can be a significant disease for older people, but also for our youngest people. So the children under a year of age are the ones who are most likely to end up in the hospital, and then people who are over 65. So just as it is for influenza, same deal. So we know these diseases do harm. The vaccines decrease the chances that you will end up in the hospital, end up in intensive care, and end up with these lingering symptoms after the disease. So what I would say is, we want to protect as many people as we can. Protect yourself and protect your family and your community by getting vaccinated so that you don't get as sick, you don't have to stay home, you don't have to not be there for your children, and you will protect the community because you're not spreading it around to other people.
So you recommend for the public to continue to receive the boosters as they come out?
Yes. So what I recommend is whatever, we have a wonderful group of advisors. So the Advisory Committee on Immunization Practices, shortcut called the ACIP, makes the recommendations for what we should be doing. And then the Centers for Disease Control and Prevention says, yes, we think that's the right thing to do. The Advisory Committee is a group of very intelligent, very well-educated people who are extremely thoughtful. They take into account safety, number one. So it doesn't matter how good a vaccine is. If it's not safe, they're not going to okay it. So I think people should feel comfortable that that recommendation is the one you should follow. And of course, you should be talking to your own physician. So for children, talk to your pediatrician or your family physician or your nurse practitioner. Talk to who's ever giving your child, they know you, they know your child. So they can give you the best advice.
What was that called again? You had the term for it?
The medical home.
The medical home.
Yes. So we want you to have a medical home, have a provider who will get to know you, will get to know your family, and therefore can give you the best advice, can listen to you, can hear your concerns, and can, tell you what's the best way for you specifically. Not for everybody in general. It's not one size fits all. It's what's the best thing for you to do.
And I think that's the most important part that you just said. It's not one size fits all. So that's one of the points that I've found myself discussing with the public as I meet them. Just refer back to your medical provider. I'm not a medical provider, but your provider knows you best, right? Exactly. So that's always been my go-to, simply because I don't know you. But another question that comes up, can I get vaccinated? Can I get the flu and the RSV at the same time? Can I get COVID and flu at the same time? I'm finding a lot of resistance on that in the community. Is it okay to get the multiple vaccines, especially right now that we're heading into flu and RSV season? Is that okay?
So the good news is, yes, you can get them all at once, or you can get them separately. So there are a few thoughts about the timing. So the RSV vaccine, which is just for people 65 and older, or 60 and older, and that's a vaccine that you should talk to your physician and get their advice, or your nurse practitioner. Talk to them, get their advice. If it's right for you, you can go ahead and get that right now, because that protection will last not only through this season, but also probably through next season as well. So for the RSV vaccine, there's no urgency. Usually the season starts in November. Last year was crazy. It started way early.
Right.
But we're thinking this year it will probably go back to November. So I would say if you're older and you want to get that RSV vaccine, go ahead and get it now. As soon as you can find it, get that over with. For the influenza shot, if you're an older adult, you want to wait a bit. You don't want to get it right now. You would really rather get it the end of September, middle of October, sometime before the end of October. So, before Halloween or before the end of October. For the COVID vaccine, I would say let's see what they say.
Right.
What the recommendations are going to be, and when you're eligible for it, go ahead and go for it.
Now, one of my last questions, I mean, we have so much that I could delve into so much with you because you're like a fountain of knowledge, a wealth of knowledge.
Thank you.
My best friend, I'm using her as an example with her permission. Her son has autism. He's on the spectrum. That was another community that had the fear of any parent that has a child with a disability. There's an extra layer of fear. If my child gets the COVID-19 vaccine, will there be additional medical issues? I think the fear is that maybe the vaccine itself will exacerbate their existing medical issue.
Sure.
I always tell them refer back to your medical provider, but they're considered high risk. So a high risk population, would you say yes, get vaccinated?
So for me, high risk is even more reason to get vaccinated. Now remember, you never know how your child with autism or some other condition, how are they going to function in the world? You don't have a crystal ball. You don't know where they're going to be a year from now. But we do know if they get COVID and they get real sick and they end up hospitalized, it's not going to be a nice time for them. And they are at risk for long COVID. So I would say if you can protect them, parents are very good at trying to protect their children from everything. And this is one where I would say protect them from disease. Get them immunized, try to keep them safe. And it depends on what the child's condition is. So for instance, a child who's immunocompromised, maybe had to have a bone marrow transplant or a stem cell transplant, something like that. That's a child who may have to be isolated, not be able to go to school if there are viruses going around. On the other hand, a child with autism, absolutely. We want them to go to school. We want them to get that interaction. We want them to have the ability for the special services that many of our schools can offer. So get them there, get them interacting. You know how to take care of your children. You know what's best for your children. That's what I always say about parents.
Right.
And I always tell young physicians, listen to parents. They know their child better than you do. So hear what they have to say and really try to take as much time listening as you do giving your advice.
Do you see that there's going to be a yearly vaccine? Is that something that you think would happen?
Yeah, so that part's easy. I think it is likely there'll be a yearly vaccine. Whether it'll just be for at-risk people or whether it will be uniform for everyone, I think we don't know yet. But I suspect that we will continue to need a vaccine unless the virus mutates to a place where it's no longer a risk. If it's just causing the common cold, then there may be some time when we can say, "Oh, good, that's behind us." I'm not, making predictions for COVID
because
of course. That is one of the things I learned during the pandemic. Don't try to figure out what COVID's going to do because it will fool you. And it fooled us in every kind of way you can think of. So the other thing I think we need to remember is to be humble. When we don't, when we make predictions, make sure we tell people this is a prediction. We don't know if this is actually going to happen. This is what we know right now, today, and here's our advice based on what we know today. That's going to change next week, next month, next year. So please don't think we're lying to you now. It's just as we get more information, we're going to be able to give you even better advice.
I love that. Thank you so much. Just in this time of me getting to have conversation with you, and I love the fact that just that this conversation with you, you ooze compassion, empathy,
you.
love, everything you have just mentioned. It's very obvious that you stand for that. I did want to have a quick question. What are your thoughts? Are people wearing the mask under their nose?
So my thought about masking is, right now, I think you have to think about yourself as an individual. What are my risks? Who do I have at home, in my home? So I have to keep myself well so I don't make them sick. So everybody's got to figure out their own individual risk. If you're going to wear a mask, and I still wear a mask when I travel because I don't know who I'm going to be with, and I feel more comfortable. You wear the mask for two reasons. The first reason is to protect yourself. If you want to protect yourself, the mask has to be over your nose because you want all of the air that you're breathing in to be filtered. If your nose is outside the mask, and most people breathe through their nose, you're only filtering part of the air. So that would be like putting holes in the mask. Why would you want to do that? So if you're going to wear a mask, wear it the right way, and that's over your nose so that all the air you breathe in is filtered. The other thing that masks do, which is really a wonderful thing, is they keep people's hands and fingers out of their mouth and their nose. And I actually just saw an article this week that adults who picked their nose were more likely to get COVID-19.
I believe it.
And we know that that's one of the ways, if you have the virus on your hand, it doesn't do any harm on your hand. It's when you rub your eyes or pick your nose that it becomes a problem. And for other viruses, like rotavirus or the viruses that cause diarrhea and vomiting, it's when you put it in your mouth. So for children, one of the other things it did was it kept their hands out of their mouth and out of their nose. And it's not just children who pick their nose. We know everybody picks their nose. If you don't believe me, look in the car next to you on your way home, and you will find that, we're all nose pickers.
And I'm glad you said that because I still think till this day, hand washing is still key. And we still need to teach our children how to have proper hand washing at home. Just at home.
And, one of the best places for children to learn that is in school. So right in first grade, they're teaching children about hand washing, and the other thing they're teaching is cough into your sleeve. I don't know about you, but when I was a kid, it was, put your hand over your mouth. That is the worst thing you can do. You don't want your hand over your mouth because now you have a handful of virus that you're going to hand to someone else. What you want to do is you cough into your sleeve, and then you can use your sleeve if you need to take care of any other secretions that might be present. So that way, you keep it on cloth, and virus that's on cloth is much less likely to be transmitted. It stays in the cloth. It doesn't end up on your hand where you stick it on a surface and then someone else comes by and touches that surface. So the things we teach children in school, hand washing, respiratory hygiene, which is they either say cough into your elbow or cough into your shoulder. Second graders, first graders learn that routinely. We adults don't remember it all the time. No, and even like the CDC thing says, cough into a tissue. So often when I give talks, I say, how many people have a tissue in your pocket right now? Not that many people carry tissues. So first of all, you don't have a tissue. Second of all, what are you going to do with that tissue? Because it's now contaminated.
And where do they throw it?
Are you going to stick it back in your pocket? Or, what are you going to do with it? So you certainly don't want to throw it on the floor. So, yeah. So simple things.
So back to school safety. Back to school safety. Vaccines, absolutely. Proper hand washing. Start putting tissue packs in their backpacks. But this is all just wonderful.
And one other thing, if your child's sick,
keep
them home.
Stay home.
Don't and if you're sick, don't go to work. We have this idea that nobody else can do our work. They'll find someone else to do your work if it has to be done. So if you're sick, stay home. Don't expose other people to your illness.
That's right. So you heard it here first. Dr. Meg Fisher, she says, get vaccinated, wash your hands, believe in the vaccine, stay home if you're sick, don't send a sick child back to school. Dr. Fisher, it's been a pleasure. We appreciate all that you've shared with us. Thank you for being a guest on St. Peter's Better for Life podcast. I know I've gained a wealth of knowledge from you today. Tune in next time for another episode. Dr. Fisher, you have been wonderful. It was a pleasure meeting you. Thank you for your time.
Thanks. It's a pleasure to be here.
The COVID-19 vaccine saves lives, which is why St. Peter's is out in the community administering free doses. For more information, including dates, locations, and eligibility, visit stpetershcs.com/COVID vaccine.